Assalamualaikum. My name is NURUL and now I will be continuing on diet and its relation to the oral health. So now I will be explaining on the differences between diet and nutrition. So firstly, diet is the food that a person habitually eats, or it is to be associated with a person's overall food intake. There are few examples of diet such as vegetarian, vegan, ketogenic, gluten-free, paleo, blood type diet, and also Mediterranean. While for nutrition, it is food that our bodies need in order to consume daily for our bodies to function optimally. The examples of nutrition would be carbohydrate, protein, fat, vitamin, and also mineral. So now, moving on to the next slide, diet can affect oral health via numerous mechanisms. Certain diet have both beneficial and disease-causing capacity, which potentially could affect the teeth, periodontal structures, and mucosa. However, dietary deficiencies are known to cause several diseases that manifest as oral changes. So, the next diet that I will be explaining is sugary diets. Sugary diets are all fermentable carbohydrate, which includes sugars and starch containing foods and drinks that have the potential to encourage the growth of carcinogenic bacteria. Eating sugary food can lead to oral problems like dental caries due to the demineralization of enamel and dentin, which are the hard tissues of the teeth, by organic acids formed by the bacteria in dental plaque through the anaerobic metabolism of sugars derived from the diet. The example of sugary snacks includes candy, regular gum, cookies, cakes, or other sweet treats contain a high amount of cavity causing sugar.
Assalamualaikum, I'm ATIQAH and I will proceed with the people that like to eat sticky food. As we know, sticky foods like resin, honey and molasses, which is like a sweetener, along with the starchy foods like bread and potato chips, can cling on the surface of the teeth and also can increase the risk of cavities. Food that are chewy and sticky are more likely to stay on the teeth longer and can cause decay that will lead to the caries. Even after rinse with water or brush the teeth, sticky particles can be left behind, so that after we eat the sticky food, we are advised to brush our teeth properly so that the sticky particle can be washed away. Let's proceed with the acidic food. Acidic contain in numerous food and drinks such as fruit juice, iced tea, lemons, pickles, salad dressing and wine can lead to the dental erosion. What is dental erosion? Dental erosion is progressive irreversible loss of dental hard tissue that is chemically etched away from the tooth surface by extrinsic and or intrinsic acid or chelation by a process that does not involve bacteria. Dental erosion will be explained further by my friends under the oral manifestation. Last but not least is drinks. Certain drinks like coffee and tea are likely to stain our teeth. That's because they contain color pigments called chromosomes which can attach to the teeth and also can stain the tooth enamel. Second is the fruit drink, which is these drinks is high in sugar and acid that can damage tooth enamel and also can lead to the decay. Third is sports and energy drinks, which is these drinks are acidic and also high in sugar. Last but not least is carbonated soft drinks. This regular soft drink contain high amount of sugar and acid that wear away tooth enamel. That's all. Thank you.
Hi and Assalamualaikum. My name is Shahirah Binti Ahmad Tazilan and now I will talk more about the nutrition in oral diseases. So, what is nutrition and what is nutrients? Nutrition is the study of nutrients in food, how the body uses them, and the relationship between diet, health, and disease, whereas nutrients are organic and inorganic complexes contained in food, which each nutrient has specific function in the body. According to the WHO, these nutrients must come from food, and they are vital for disease prevention, growth, and good health. There are many essential nutrients. They can be broken into two categories, which are macronutrients and micronutrients. Macronutrients are eaten in large amounts and include the primary building blocks of your diet, which provide your body with energy. They include protein, carbohydrates, and fat, whereas micronutrients are substances which people need in their diet in only small amounts. These include minerals and vitamins. Macronutrients include carbohydrate, protein, and fat. Carbohydrates are the body's main source of energy, whereas protein are often called the body's building blocks, and fat can give us energy and help the body to absorb certain vitamins. Micronutrients include vitamin and mineral. Vitamins have different jobs. It helps our body in resisting infections, keeping our nerves healthy, and help our body get energy from food. Minerals also help our body to function well. So, what are the effects of nutrients on our oral health? Now I will tell you more about what are the effects of carbohydrate on oral health. So carbohydrates are an important part of a balanced, healthy diet, but they are also one of the main culprits in tooth erosion and decay. So this picture shows on how does the caries can happen on our tooth surface. The bacteria or germs that are contained in the plaque that forms on teeth that exposed to the sugary or starches from the food this combination can produce acid that actually can lower the oral pH. So if the oral pH below than the critical level, which is 5.5, this can initiate demineralization of tooth enamel and can lead to cavitation. Next, the effects of protein on oral health. Protein serves as a building block for bone and the periodontium. It improves the strength of teeth and the jaw. Protein also reduces caries risk as it reacts with the salivary constituents and prevents the aggregation and attachment of mutant streptococci. It helps to build and repair damaged or worn-out tissues. Now, the effects of lipid on oral health. Research indicates that high-fat foods tend to be inhibitory towards dental caries. Fatty acids, example linoleic, in low concentration inhibit the growth of the mutant streptococci. It enhances the development of karyostatic oral biofilm. Lipid also produce a film on tooth surface or on the food particles that can prevent bacterial digestion and penetration of acid to the tooth surface. There is a study that stated monoglycerides of lauric acid from coconut oil had antimicrobial activity against various gram-positive and gram-negative organisms, which help in reducing gingivitis and halitosis. There are a lot of effects of vitamin and minerals to our oral health. So for vitamin, those include vitamin A. Vitamin A helps in keep our mucous membrane healthy. Vitamin B3, it can prevent bad breath and mouth sores. Vitamin B12 and B2 can reduce the risk of developing cancer. Vitamin C, it help in producing collagen. Vitamin D, it enables the body to absorb calcium, which helps in build strong bones and teeth. Vitamin K, it helps in producing osteocalcin, a protein that supports the bone strength, also noted for its role in blood clotting. Now, for minerals, those include calcium. It is essential for bone health. Iron, a deficiency can cause tongue inflammation and mouth sores. Phosphorus, it needed for healthy bones and teeth. Zinc, it promotes strong bones and help develop and maintain collagen. Magnesium, it important for bone formation. Potassium, it helps promote the good mineral density and reduce calcium loss. And lastly, for fluoride, it prevents tooth decay by making the enamel more resistant to the action of acids.
Okay, now we will proceed with the oral manifestation that related to diet and nutrition. So the oral manifestations that we will present will be dental caries, dental erosions, periodontitis, and oral cancer. So teeth are most susceptible to dental caries soon after they erupt. Therefore, the peak ages for dental caries usually between 2 until 5 years old. Deficiency of vitamin D, vitamin A, and protein energy malnutrition have been associated with enamel hypoplasia. So this enamel hypoplasia will make our teeth vulnerable to tooth decay. And then lack of vitamin A and protein energy malnutrition also associated with salivary gland atrophy, which is less saliva. So it reduces the mouth's defense against infection and its ability to buffer plaque acids. While chirogenic foods such as crackers, chips, cereals, breads, sugars, sweets, desserts are fermentable carbohydrates that can cause a decrease in salivary pH to less than 5.5. So it will later promote the formation of caries. Okay, keep in mind that eating patterns such as frequent and prolonged intake of foods rich in simple sugar, eating sticky, retentive foods alone, and sipping sugar-sweetened beverages for prolonged period may also increase risk of dental caries development. Okay, basically, dental erosion can cause by intrinsic acids such as vomiting and regurgitation, and also extrinsic acids. So the example of extrinsic acids are citric acid, phosphoric acid, ascorbic acid, malic acid, tartaric acid, carbonic acid, which is found in fruits and fruit juices, soft drinks such as carbonated drinks, dry wines, vinegar-containing foods. So as we know, the critical pH of enamel is 5.5, and therefore any drink or food with lower pH may cause erosion. Erosion will reduce the size of teeth and in severe cases leads to total tooth destruction. Okay, now we will proceed with the periodontal disease. Okay, first, lack of protein intake may compromise or impair response to infection and wound healing, and also will compromise antibacterial properties of saliva. And then lack of vitamin D, vitamin K, calcium, boron may cause inadequate jaw bone density and strength to anchor tooth structure. And severe vitamin C deficiency can result in inflammation of the gingiva. But the most important factor in preventing periodontal disease is good oral hygiene. So undernutrition is just increases the severity of oral infections such as gum disease. Okay, oral cancer. Diet high in vegetables, fruits, antioxidants, tea, and fiber decrease the risk of oral and pharyngeal cancer. Why? Because these nutrients can prevent the activation of carcinogens and their detoxification. And then calorie intake that larger than calorie expenditure results in overweight or even obesity. So it is risk factor for development of cancer. For example, monounsaturated fatty acids, which is U9-oleic acid, is behave as tumor promoter in breast, colon, oral, and salivary gland cancers. Next, micronutrients such as vitamin C, vitamin E, beta-carotene, folate, and zinc have an important role in the prevention of oral cancer. Why? Because these factors can cause polymorphism in detoxifying enzyme GHT and other metabolic genes, which modulate risk of cancer and decrease the genotoxic damage. And the last one, based on the study, heavy alcohol consumption may influence the risk of oral squamous cell carcinoma, or SCC. It is approximately one-third of men patients with oral cancer are heavy alcohol users. Nutritional deficiencies associated with heavy alcohol consumption also contribute to OSCC. Okay, so here we can see this table shows the correlation between the risk of oral cancer, especially squamous cell carcinoma, with environmental factors such as food and habits in USA, Asia, and Europe. So dietary factors here such as low intake of antioxidants and fiber, high intake of monounsaturated fat, and low intake of micronutrients may give risk for oral cancer. And also alcohol consumption here can give risk for oral cancer.
Now let's move to the case report. The title is dental erosion from excessive intake of vitamin C. This case effectively demonstrates the localized effect of vitamin C that induced the acid erosion in patient mouth. And this case can be a good example for diet and nutrition intake because it shows how the relationship between diet and nutrition to the oral disease. So this is the case detail, which is a 51-year-old Nigerian male was admitted himself to the emergency department, and he was complaining of left side jaw ache and have an uneven bite and unhappy with his front teeth appearance. He was worked as an engineer. For history of chief complaint, the pain had been going on for the previous 2 or 3 years, but the pain became more apparent over the previous 2 months. And he also explained that the issue of his front disappearance also get comment from his family members. So, for social history, the patient was questioned about his diet and nutrition intake to assess if there is any specific intrinsic or extrinsic factor that can contribute to the problem. And surprisingly, the patient was admitted that he was chewing multiple vitamin C tablets on almost a daily basis for 3 years. He started consuming the vitamin C because his friend advised that the vitamin C was beneficial for his general health. So he took 5 to 6 of these chewable tablets and will be kept in his pocket each day, so he enabled to continue suck and chew on this vitamin C tablet during his 90 minutes morning commute to work. So after the detail was get, the dentist do a extra oral examination, and he was found there is a slight tenderness to the tooth palpation on the left masseter and lateral pterygoid muscle, but he exhibited a good opening with no deviation or marked antigonal notching. So for intraoral examination, the dentist marked a tooth wear on the upper and lower incisor and left side posterior teeth, and there is a loss of outer two-thirds of the enamel on the mesial aspect of the upper 5 incisor, and the lower incisor also had lost around a third of their clinical crown height, maybe due to the dental erosion, and chipping of the lower lateral incisor was noted. And there is also characteristic of cupping of the enamel with staining on the underlying dentin. So from the figure 1, we can see why the patient felt Why the patient does not like his appearance? Because his teeth look yellow and wear. So, after taking the detailed history and examination, the dentist come up with a few diagnoses, which are left side myofascial pain, second, erosive and abrasive tooth surface loss, third is right side scissors bite. For the first diagnosis, is because patient complain of left side pain, or for the second, it is because for at the intraoral examination, dentist found there is a enamel loss. And for the treatment option, the dentist uh, supplied the patient with a lower soft acrylic mouth guard in an attempt to ease the left side facial pain. So it will help the patient to control their occlusion. The patient also was referred to the joint orthodontic restorative team. And the orthodontic restorative team gave a few treatment options, which are fixed orthodontic to correct the scissor bites, and second is a direct composite build-up. Moreover, dentists also advise him to stop consume the vitamin C supplement and try to get the vitamin C from natural ingredients such as vegetables and fruits. And after 3 month review, the patient came and he had no complaint of pain and he was happy with the appearance and function of their teeth. Okay, lastly, for the discussion case, we know that vitamin C, which have ascorbic acid, has a low pH and can contribute to the dental erosion. And you should know the exact amount that required for an individual because it depends on their gender, weight, and general. Patients also commonly misunderstand the dosage information on prescription drug labels, although they buy it from the drugstores or pharmacy. So, often as the case here, patients are drawn towards increasing their vitamin C intake for so-called health benefits, and this case has shown that if their use is excessive, frequent, and limited to certain pairs of occluding teeth for a prolonged time, it will lead to a significant surface loss. So, lastly, for the case summary, uh, patient come and demonstrate moderate to severe dental erosion. It is due to daily intake of chewable vitamin C tablets over the course of 3 years without appropriate dosage information. Then, after the dentist found the problems, dentist give preventative advice was given and localized composite resin restoration was put on the tooth that wear. And lastly, patient coped well with the treatment and his vitamin C intake was reduced to a moderate. So, in as a conclusion, this case demonstrates how as clinicians we are responsible for advising the patient on potential signs of acid erosion and guiding them towards safe level of use to prevent any adverse effect on their dentition. So, we should know how to control our diet and nutrition. We should not take less or more. We should take the diet and nutrition amount at a moderate level to get a healthy life and avoid oral disease. And this is the references. Thank you.